Regarding investigations for chest pain, which one of the following statements is true? A. A new ST segment elevation is greater than or equal to 1 mm in two contiguous leads on electrocardiogram has a 50% positive predictive value for diagnosis of acute myocardial infarction, AMI. B. Troponin is specific to myocardial damage and is infrequently elevated in other pathology. C. Any troponin elevation above threshold has prognostic significance in patients presenting with ACS. D. Exercise stress testing has a high sensitivity and specificity for coronary heart disease and is a useful investigation to diagnose coronary artery disease. Pause and answer. Answer is C. Any troponin elevation above threshold has prognostic significance in patients presenting with ACS. Approximately half of the patients with AMI will have an initial ECG showing a new ST segment elevation is greater than or equal to 1 mm in two contiguous leads. Its positive predictive value for diagnosis of AMI has been described as greater than 90%. Patients with an elevated troponin have a worse 2 and 28-day prognosis compared with patients without an elevated troponin. Compared with conventional troponin assays, with the use of new high-sensitive troponin assays, both TNT and TNI, troponin can be detected at much lower levels. Consequently, these superior performing high-sensitivity assays have increased sensitivity in early detection of AMI. However, these increased sensitivities have been achieved at the expense of reduced specificities. In the absence of ischemic heart disease, troponin can be elevated in a range of non-ischemic pathologies. This should be considered when interpreting troponin results. Troponin can be elevated in the following non-ischemic conditions including sepsis and critically unwell patients, pulmonary embolism, renal failure, myocarditis, myopericarditis and myocardial extension of endocarditis, stroke and subarachnoid hemorrhage, aortic dissection, congestive cardiac failure. Both acute and chronic cardiac contusion, pacing, ablation, cardiac surgery, tachyarrhythmias, bradyarrhythmias and heart block, respiratory failure. Exercise stress testing is a functional test that is prognostically useful in predicting adverse events for coronary artery disease, CAD, despite its limited sensitivity and specificity in diagnosing CAD. It is useful for risk stratifying low to intermediate risk patients.